Hello, good evening, and how are you? Welcome, wherever you're joining me from on YouTube or Facebook. How are you doing, and how has been your weekend? So, if you can hear me, tell me where are you joining me from? I want to give you a shout out briefly. Welcome. This is the Ask the Doctors every Sunday by 8 p.m. Ask the doctors every Sunday by 8 p.m. So I see some people here. We are currently live on Facebook and we are live on YouTube. So I want to know those that are joining us on Facebook and those that are joining us from YouTube. How are you? I see you. Ayola Abiola, good evening. Obi Clements is joining us from Newi. Okay, I can see you all. Toby Jimmy is joining us. Okay, Asibo Helen from Lagos. Toby from Abuja. How are you? Welcome, everybody. Please share this video. Share this video. Welcome. Good evening, Princess. Good evening, Oluwayomi. Ayola from Monrovia. Joe, good evening. Michael David, good evening. Angela is joining us from Calabar. It's been a while. Angela, how are you? Let's see who else is here. Gabriel from Cross River. Sammy Agedo from Edo State. Sammy, how far? Yes, welcome everybody. I see you all. So we are currently live on YouTube and we are live on Facebook. Today we're talking about typhoid fever. Yes, we see somebody joining us from YouTube. Marvin Stone from YouTube. Marvin, how are you? Very good. From Paris. Oh, interesting. Okay, do me a favor, everybody. Please share this live stream. Ask Nurse Samuel. Destiny. Yes, Destiny is joining us from YouTube. Destiny, I see you. How are you? This is Ask the Doctors every Sunday by 8 p.m. West African time. My name is Dr. Frederick Unubohai, and I always tell you good life in a sense. I'm not alone. I have my co-host here with me. I'm hoping they'll be coming up very soon, Dr. Israel and Dr. Blessing. We'll be talking about typhoid fever today. Hmm. So let's do something quickly. Today is going to be very interactive because this is the first time we are having this program on Facebook and YouTube at the same time. So tell me, everybody, in the comment section, tell me, what do you know about typhoid fever? I'm not telling you to go and search on Google. Oh. Don't do that. Everybody, Azuka, Sunday, Khadijat, Mercy, Adeola, Queen, Smarty, Grace, Princess, Samuel, Destiny, Teresa. Tell me, everybody, in the comment section. Just tell me, what do you know about typhoid fever? Simple. Huh? Let's do that quickly. Don't ask any question yet, please. We'll take your question, but for now, we are just starting. So let me give you one story. Let me give you a story. So in the early 1900, in the early 19th century, there was a woman. This is a true life story. There was a woman, and this woman traveled from Ireland. So she got to New York. And when she got to New York, she was employed as a cook. So she was preparing food for people. Please share this video, share this video, share this video. Good evening, welcome. So she worked as a cook. That was, I think, around 1888, I guess. So she worked as a cook. And then suddenly some people fell ill. But before they could report the case, she had moved on to another family. So she was employed to cook food for people. And where she was initially employed was not like the rich area. So they employed her in a rich family. So this woman went there. Her name was Mary Malone. Mary Malone. That was her name. So she went there and she was cooking for them. And then one day, the family fell sick. So they had to look for the diagnosis. And they discovered that this family had typhoid. And they were like, why are we going to have typhoid? We are rich. We don't have a dirty environment. We don't eat leftovers. We are clean and the rest. So they invited someone to investigate. They invited a doctor known as Dr. George. So Dr. George came over and was trying to investigate what was causing this problem. He was looking around, checking the water and the rest, and it was like, okay, so who prepares food for you? So they said, oh, it's our cook, this lady here, Mary. Okay, so then the doctor then went up to Mary and discussed with her. Mary, where have you worked before? Did little investigation, and then he noticed that Mary had worked somewhere before, and the people where she worked too, they fell sick. And then he looked at Mary. Mary, when you go to toilet, do you wash your hands? He said, no, I'm very busy. How would I wash my hands when I go to toilet? I'm just busy. I'm preparing food for people. What do you prepare for people? So she prepares food and she also prepares ice cream for them. And she doesn't wash her hands. So I'm like, what's going on? So they checked and checked and discovered that Mary had typhoid. So he told Mary, Mary, you get typhoid. You're sharing typhoid to these people. And Mary rejected. She chased them away. And then they called this doctor. Again, Mary left that family to another family. And the daughter, the child of that family died. And the doctor went there to investigate again and discovered that Mary was the cook. And then he said, Mary, you are the cause of this typhoid. You are the cause. So they took Mary away. They took her to quarantine. They locked her there for 3 years. They told her, Mary, you are spreading typhoid to people. They didn't break it down for her. They didn't explain to her. So she was like, no, it's not me. They didn't really explain to her. And after about 3 years, they told her, Madam, we can't keep you here forever. We have to let you go. But you need to promise us that you will not go out again to cook for people. Oh. So Mary said, yes, she would not cook again. And after a while, Mary needed money. She was an immigrant. So Mary was employed somewhere, but she changed her name from Mary Malone to Mary Brown. And they called this same doctor again. There is a problem. There's typhoid in a hospital. So the doctor went there. They were investigating and investigating. And then they asked, who is your cook? They said, why are you asking us who's our cook? This is a hospital. We are clean and the rest and the rest. Lo and behold, they saw the same Mary that they saw before. The same Mary that they told not to cook. I'm going somewhere. Said, are you not Mary Malone? Now you change your name to Mary Brown. So you are the cause of the problem. So they took Mary away and they locked her up. And after about more than 20 years, Mary died. And as she died, they took out her gallbladder and discovered that Mary had typhoid, the bacteria in her gallbladder. So what really happened? Typhoid Mary, she was later named Typhoid Mary. She was spreading typhoid fever. She was spreading the bacteria, but she had no symptoms. So she was a carrier, asymptomatic carrier of typhoid, spreading to people. I hope you listened to this introduction, right? And you understood where I was coming from and the reason why I had to share that story. So Typhoid Mary was recorded to be the first asymptomatic carrier of typhoid fever. You can read more about it. So what is typhoid fever? Typhoid fever is a bacterial infection caused by Salmonella bacteria, Salmonella typhi or paratyphi. Okay, we have our guest, our co-host in the house. I say guest, sorry, Joe. My co-host is here. Dr. Israel is here tonight. Yes, Dr. Israel. Dr. Israel, good evening. How are you?
Good, fine. Good evening. Happy Sunday.
Happy Sunday. Welcome. How have you been now?
I've been fine. I wanted to say, I guess, as if, please, oh.
I fear, oh, I fear. I say guest, Bawo. Yes, yes. So, welcome everybody. So let me quickly share up round up my story and then we go to the next part. So typhoid is caused by a bacteria, Salmonella typhi. We have another one called paratyphi, and I shared with us the introduction, typhoid Mary, the history of typhoid fever. So I was asking everybody, tell me in the comment section, what do you know about typhoid fever? So quickly, ladies and gentlemen, let me show you your comments. Typhoid fever is being caused by bad water intake. Typhoid fever is a bacterial infection that affects the human intestine from Queen. Adeola says, I think it's a sickness caused by water, food, and so on. Khadijat says, to my own understanding, it is an infection in the stomach by eating contaminated food and water. Princess says, unclean water can unclean water cause typhoid fever? Ayola says it has to do with both food and water contamination. Smart says typhoid is a bacterial infection. Smart says Salmonella typhi. Okay. This is Oladare from TikTok. I see you. Welcome. Okay. Is this Dr. Israel? Okay, Israel. No, this is not Dr. Israel Oladare. This is Israel Irobonose. So, Dr. Israel, welcome. Now, quickly,
Thank
let's talk
you.
about the causes of typhoid fever. What are the causes of typhoid fever?
It's not I don't think, should we say what are or what is the cause of typhoid fever? Because it's caused by bacteria.
Yes.
It's caused by bacteria. I think the other the risk factors and all that can lead to injection of this bacteria. It's caused by bacteria known as Salmonella typhi. And okay, we can also have paratyphi, paratyphi and so on. But Salmonella typhi is actually the main culprit when it comes to typhoid fever. When it comes to typhoid fever, yeah, we can actually get this Salmonella typhi via through taking in of contaminated water, contaminated food, and through human to human contact. Someone that is affected with the virus before, sorry, with the bacteria, I said virus, with the bacteria before can actually transmit it to someone else. So that's why we can say human to human contact. Now, this bacteria can manifest within the first week to the third weeks of when someone get in contact with it. Yeah, that's how it manifests. That's a simple. It can be mild and it can be very severe. Now, children are mainly infected with this bacteria, but most of the time it gives them mild symptoms. Yeah, but adults, when adult gets it, yeah, majority of them can come down with with severe symptoms. So when we talk about contaminated food, contaminated water, we are talking because the mode of transmission of this bacteria is fecal oral. When we say fecal oral, we mean from the anus to the mouth. Yeah, that's what it means, from the anus to the mouth. So, Dr. Fred, can you lead me on again?
Okay. Thank you. I see people joining us. Beatrice on YouTube. I see you on YouTube. Okay. Now, if you are just coming, we are talking about typhoid fever. What Dr. Israel has said, everybody, please let's listen carefully. Typhoid is caused by a bacteria. You get typhoid from contaminated food and water. Number one, contaminated food and water. Number two, typhoid is spread from individual to individual. So if somebody has the bacteria, the person can also spread the typhoid fever, the bacteria, to you. Fecal oral, Dr. Israel mentioned fecal oral, meaning that this bacteria is gotten from your feces, your poo-poo. That is where this bacteria is gotten from. So when this bacteria enters your food or your water, it goes into your mouth, and then you get ill. Some people can actually have this typhoid in their body, prepare food for you, and you can get the infection, just like how I spoke in the very beginning. So we've spoken about the causes and the transmission, the way people get. So you cannot get typhoid fever from mosquito. Mosquito bite cannot give you typhoid. Am I right, Dr. Israel?
You are very right. Mosquito bite does not give typhoid fever. If it's mosquito bite, you'll be thinking about malaria. Um, Malaria first before any other thing. So
Thank
mosquito bite cannot give you typhoid fever. So it's via when we say transmission, we are talking about how you can get it. We call it fecal oral, from the anus to the mouth. That is from stool to your food or to your water. And it's more common in this developing country. It's more common in developing country, and Nigeria being a developing country is also common because of sanitation. Poor sanitation also makes it very common. You know, when after stooling, some persons will not wash their hand very well and all that. They dip it inside food, and when you eat such food, you can contaminate yourself or drink. Some persons that still drink water from river, from stream, and that same river is where some persons will still pass to and all that. They can still get contaminated through that means. Now when we talk yeah, we've already talked about human to human contact. Yeah, some persons that have been contaminated before, even after they have been treated from typhoid fever, for some time they can still be transmitting the bacteria, if because as at that time they are not having any signs and symptoms, so they are fine. But that bacteria they can still transmit it during that period, because that time you can still see the bacteria in their stool, even in their urine. You can still see the bacteria in those part of their system. Yeah. So Dr. Fred.
Thank you very much. For those that just coming, welcome. We're talking about typhoid fever today. So let's go to the next one quickly. Very, very important. The symptoms of typhoid fever. I believe that everybody is waiting to listen to the symptoms. But please, let's say this here. In case we list any of these symptoms and you have the symptoms, we are not saying that you have typhoid fever. It's very important you go see your doctor so that they will make that diagnosis for you. Not because we mention headache, and then because we mention headache, you now feel that, oh, my headache is caused by typhoid fever, or because we mention fever, and you feel that, oh, my fever is now typhoid. No, please, I beg you. Remember, we are not here to diagnose you or manage you. We're just here to educate you. Are we together on the same page? So, Dr. Israel,
Yeah, yeah,
um,
very together.
let's yes. Let's talk about the symptoms of typhoid fever.
Okay, one thing we should know is that most of the symptoms of typhoid fever is almost the same symptoms when you have malaria. So most people often confuse malaria for typhoid fever. That's why when you go to that's why most people like to treat as you guys normally treat malaria, typhoid. So most of the time you never had typhoid, you just only had malaria. Yeah. So because most of the time they have the same symptom. One of the symptoms is increased temperature, which we call fever, and it starts gradually. It can start very mild, then increase as the days continuously, and it can be as high as even 40.5 degrees Celsius. Can be as high as that. So, but the difference between fever in typhoid and that in malaria is that typhoid fever is continuous, and continuous throughout the day. Is there, it's present throughout the day. It doesn't give you time. But for malaria, it's not present throughout the day. It's intermittent. Let me use the word intermittent. It comes mainly, yeah, okay, down now. It comes mainly in the evenings. You can be the person can be playing during the day. Once it's getting to evening time, you start seeing the person, the temperature start coming up and all that. That's one of the difference between the malaria, the fever you see in malaria and that you see in typhoid. Another thing, there's general body weakness, there's abdominal pain, and there can be constipation, there's diarrhea, um, there's body weakness. I think I've said that for general body weakness, there's body muscle pain as well. muscle pain as well. These are most of the symptoms most persons we come down with. And okay, there's also headache. Uh, as time goes on, if not treated on time, we can start having delirium, now having some psychological symptoms where the person will be seeing, we've seen some different things from what what is really happening in what is really happening. Then you can also be seeing stool, blood in your stool and all that. And at that point, then you have severe abdominal pain. The pain in the stomach is so painful, and then you can be having a perforation in the intestine. So those are like the complications which some persons can even present with as symptoms as well. Having severe abdominal pain, and when we do some investigation, we notice that there are perforation in the intestine, and so on and so forth. Some persons can even come in. Some persons can die from this, from all these symptoms I've mentioned.
Yeah. Thank you, Dr. Israel. Welcome, guys, for those that are joining us. Do us well. Please share this live stream. Share this live stream, everybody. So the symptoms, as Dr. Israel has mentioned, fever. For typhoid, the fever is usually said to be step ladder fever, um, gradually increasing step ladder fever. And then you can have constipation, you can have diarrhea, you can have abdominal pain, headache. And he mentioned again, you can have delirium. It can affect you mentally upstairs, or what we call typhoid encephalopathy. And in some cases, you can have renal failure. You can have organ dysfunction. It can affect your heart. It can affect, so it can cause systemic infections um, all over the body. Very importantly, as mentioned by Dr. Israel, you can have intestinal perforation. That is, your intestine if it bursts. Let's understand. Having said this, there's this common complaint we always hear. Patients will come to the hospital, doctor, I get typhoid and malaria. And most times, the doctor will tell you that if you really have typhoid, I don't think you'll be able to explain and discuss, because at the very early stage, the symptoms might be just mild. But if it's the real typhoid at the second phase or the third phase, it can be very severe. And if not handled properly, it can lead to loss of life. So let's quickly talk about the diagnosis. How would you know that you have typhoid? What are the gold standard tests that we conduct for patients to really know that he or she has typhoid fever? Dr. Israel, want to throw light on this?
Okay. Now, when you get to the hospital, most of the time, I know some persons will want me to talk about wider. I will leave wider for now. We'll talk about wider later. I will leave wider for now. Okay, now for before we make an diagnosis of typhoid, apart from the signs and symptoms that we notice, yes, which will suggest that, man, this person can have typhoid. Remember, I said most of these signs and symptoms are almost same like malaria, but one of the differences, but I only give you the difference in the fever. But for some children, it may even be the same. So, but the ways we can actually say, yeah, this is typhoid is when we do the investigation. And one of the investigation we can do is 2 MCS. That is, we collect your stool to find out if there's salmonella typhi in the stool. So when we do the MCS, microscopy culture and sensitivities, and there's typhoid, salmonella typhi in the salmonella in the stool, then we can actually say yes, this person has typhoid fever. Also, we can, if we cannot get it from there, we can also do blood culture. Blood culture can also tell us if there is typhoid in the system. The first we do is this 2 MCS before we go for the blood culture. Sometimes we can also do urine MCS, and if it shows salmonella, we can also say yes, this person is having typhoid. Because remember when I was talking about the transmission when we say fecal oral, we said from stool. I also said for urine, from urine as well. So it can be gotten from the stool, from the urine. So the salmonella can be seen in these places. So at the early stage, we can actually see it in the stool. But if there's, we can see even the ova in the stool. Then in the blood, we can find it as well, and in the urine. So those are the gold standard when we talk about diagnosis, when we talk about investigation of typhoid fever. So, Dr. Fred, should we just dive into wider so that,
Yes,
or
yes, yes,
later?
yes. Let's talk about whiteout. Let's talk about whiteout, and also let's talk about it.
Okay.
Yes.
So those are the gold standard to check to know if someone really have typhoid fever. Now we know that most hospital or most stores or most I don't know, or most places normally do what we call wider test. Yes, wider test was once used in the diagnosis of typhoid fever. Was once used. Oh, I use the word was once used. However, it is not a single test. It's not a single test of wider that is done for a patient that will say, yes, this person actually have typhoid fever. You will do a serial testing of up to 4 times. And when we do this serial testing and we see a serial increment in the titer value, then we can now say this person has typhoid. But the one we see these days that you just do one test and the person will say yes, this person have typhoid. It's actually wrong. All those one in 80, one in 160, one in 320 that you see just for one single test. Um, we don't just do it that way. We do it like 4 serial times. And when we notice that scan increments continuously, we can now say, yes, this person have typhoid. The reason is because wider tests, so many other things can actually increase the titer value. Yeah, so many other things can increase the titer value. Even to the drug you take can increase the titer value. Even the drug can increase it, stress can increase it, and so many other things. So even malaria can increase it. So that's why we don't use that as a definitive way of making our diagnosis. And that's why also the reason we don't just do one of it and say, yes, this person have typhoid. We need to do a serial testing for that patient. So I will want to let you people know one thing you should take home. The first thing you should take home is that wider test that we most people do is not a way of diagnosing typhoid fever. It is not a way of diagnosing typhoid fever. Thank you.
I really hope we understood what Dr. Israel said. To understand that we are together, ladies and gentlemen, listening to me on Facebook and on YouTube, I want you to comment, please, down here right now, and I'm going to post it on the screen. What is the gold standard test for typhoid fever? Please, I beg you. Let's understand what we are saying. If you know that you are following us after what Dr. Israel said, what is the gold standard test for typhoid fever? Or what are those tests that can be done for typhoid fever right now? So please drop it in the comment section. I'm waiting for you. Maria, I see you. Welcome. We are live on Facebook and YouTube. Please, you can do well to share this live stream. Um, let's go to the treatment of typhoid fever. I don't want to talk more again on the wider. Dr. Israel has said the treatment of typhoid fever is based on your diagnosis, number one, and the use of antibiotics. Now, we are not going to prescribe antibiotics for you here. And there are different type of antibiotics that is being used. Also, it's important you know that there's now resistance, antibiotics resistance, and some of the antibiotics that people now use out there are resistant because we even have different strains, or we call, for you to understand, different types of the salmonella. Now, some of these types of bacteria are now resistant, and there's one common antibiotic our people abuse, ciprofloxacin. Everybody, the moment they notice that I have headache, body pain, the person begin to buy Cipro. Paul is just coming. Paul, you will have to watch this video again. We have passed this place, my brother. We have answered your question. Please, we cannot repeat. I beg. We're moving with time. No vex, my brother. So people buy ciprofloxacin whenever they notice that they have headache, abdominal pain, thinking that it's typhoid, and sometimes um, they might be treating something else. So, Dr. Israel, do you want to add anything to the treatment of typhoid fever?
Now, the treatment is the use of antibiotics. Yeah, that is at the early stage when is diagnosed on time. That is when the patient presented on time to the hospital and is diagnosed on time. So the treatment is the use of antibiotics. When we use antibiotics, we are sure that it will kill the bacteria and the person will be okay. Yeah. Remember I said something that yes, we would have treated you from the bacteria, but you may still be carrying some of it. That is, you may still be transmitting it as a chronic and in a chronic stage of it. However, there are other form of treatment, and this will be due to the complications that the typhoid fever can cause. And one of the complication which is more common is the intestinal perforation. When there's intestinal perforation, so when there's intestinal perforation, that will lead to surgical intervention. So at that time, we want to do surgery for the person to get to the place of the perforation and see if it's what and see what we can do to that perforation. So that's another part of treatment, but that is when there is complication in terms of typhoid fever. But when it is straightforward typhoid fever, is the use of antibiotics. And as Dr. Fred earlier said, yes, most antibiotics are now resistant to drug because we overuse them, and also we don't use them rightly. You prescribe drug for you for 5 days, you use it for 3 days because you are feeling better, and you leave the remaining days. Well, that's not how to use it. Or they prescribe the drug for you for a week, you use it for 5 days, and you said you leave the remaining 2 days for the gauze. That's not how to use it. When your doctor prescribe drug for you, please try and use it as prescribed. But sometimes we even prescribe it morning and evening, and you tell yourself that no, I cannot take it morning and evening, I can take it once a day. That is not the prescription. That's not how it is prescribed. No. So these are some causes of resistance, antibiotics resistance that we are having. Excessive use of it when you don't even need it, and when you even need it, uh, 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 poor poor administration, and two, the patient themselves don't take it as don't complete the dosage that is being given to them. So these are things that will lead to that. And when it happens, it can actually now lead to complication, which will lead to surgery, as the case may be, or maybe other use of other antibiotics, which may be expensive more than what you would have used. Thank you.
Thank you, Dr. Israel. If you are just joining us, we're talking about typhoid fever tonight. We are live on Facebook and we are live on YouTube. If you have questions, for those of us that have been listening to us from the very beginning of this discussion, if you have questions, please ask us. If you are just joining, you are welcome. We have discussed what is typhoid fever, the cause of typhoid fever, how is it gotten. We spoke about the symptoms. We spoke about how to make the diagnosis. We spoke about the difference between your malaria and typhoid. I also told you that they are not brothers and sisters. Not that you must have malaria at the same time you must have typhoid. They are never together. And we also told you about the treatment. So if you have any questions, please feel free to drop your questions down and we will take it. Let's hammer again on the chronic carriers, the asymptomatic spreaders or asymptomatic carriers. We spoke about this at the early part of this discussion. Now, asymptomatic carrier, as we spoke about this before by Dr. Israel, these are people who have the bacteria in them, they don't have any symptom, and they continuously shed this bacteria out. Sometimes they prepare food for you. So if you know that you purchase foods outside and you're not really sure of the sanitation, the hygiene of this person preparing food for you, or the medical history of this person, there's a very high tendency that you might be getting your food contaminated with the bacteria that causes typhoid fever. So there are a lot of people that can actually spread this bacteria and they have no symptom. Um, so somebody is asking us a question. Please, doctor, is it true that medications cannot get rid of typhoid fever except you make use of herbs? That is agbo. Adeola, false. Dr. Israel, you want to react to this?
Uh, when we were talking about the treatment, I cannot remember we saying anything about herbs or agbo. Because if that is the treatment, I think we would have also told you that that's the main treatment. However, the main treatment is the use of antibiotics, and that's the treatment. Apart from the treatment, it is also better to know that prevention is better than cure.
Yeah,
Normally, now these days, the medical world, we are trying to move into prevention. In fact, we are moving towards prevention. We are into it, but we are not fully into prevention. But that's the key. Prevention is better than cure. It's also cheaper than cure. It's as funny as that. It's cheaper. It's cheaper than cure. So when we try to prevent the spread of these diseases, we'll be saving ourselves, not only ourselves, we'll be saving many persons around us. And how do we prevent typhoid fever? One of the ways, I'll just list some few ways. I think Dr. Fred will add to it before we continue
yeah,
your
yeah,
question and answer. So one of the way I always like talking about when it comes to bacteria spreading, virus and all that, um, is hand washing. Hand washing is just so interesting when it comes to prevention. Yeah, we should also remember the mode of transmission. Now I can remember I told us that the mode of transmission is fecal oral. So from the stool, from the anus to the mouth, that's fecal oral. So one of the way you can prevent fecal oral is hand washing. After using your toilet, you wash your hand very well. You wash your hand. Eh? Before cooking your meal, you wash your hands. It's very important. And another thing is keeping um, your environment clean. Um, apart from that, apart from that, if you must eat food, try and warm your food. It should be hot when eating it. It should be hot. So some of us that go to um, that buys food from different places, sometimes they just give you the food and it's no longer hot. You just carry it and you devour. Sometimes the bacteria can just be on that on the meal you are eating. However, if you tell them to just microwave it or warm it for you, it can help to destroy the bacteria. It will help to destroy the bacteria. So eating of hot food, um, making sure that you wash your hands very well, and also your water that you take are well treated, and well treated water can also help to prevent this typhoid fever. Now, it's also known that, are we still together,
yes,
Dr.
yes. I
Fred?
can hear you. Go ahead. Go ahead. Go ahead.
Okay. It's also known that it is also known that because we are in because of the third world, sorry, developing country, most technique to prevent typhoid fever is still not too strong. And the use of hand washing, making sure that your water is well clean, uh, uh, and all that, it's not still too strong. Even eating hot food, most of the time when we buy food there, it's not hot. So that brings about the use of vaccine. Yeah, there's vaccine for typhoid fever, but I will let you know, So you not say the same vaccine, they let me go and take vaccine and that's all. No, the vaccine is also not 100%. So even when you take the vaccine, you still need to keep to all the other ways of prevention. Yes, the vaccine will protect you the long run, and also you should know the vaccine is not a life vaccine. It's not you take the dose now and it's for life. No, it will also wear out. So it wear out after some years. Yes, that's for the vaccine. And the vaccine is just a single shot, which areas where typhoid fever are very common, it is advisable that people get the vaccine. And after you get the vaccine, you know you are protected for some time, and also you use other means of prevention. And with that, I don't think you fall sick anyhow of you fall sick of typhoid. Okay, so those are just some preventive measures I want to say. Dr. Fred, you can add others.
Okay. Yes. You've spoken about everything, talking about the prevention. The only thing I might want to add would be for the chronic carriers. The chronic carriers are actually those who have the bacteria in their stool without any symptoms, and these people most times might be treated for more than a month. You understand? Hmm? Uh, yes. Let's see. So let's take questions quickly. Let's move very fast. Can the bacteria be transferred by sweat? No, no. Dr. Israel,
There's
yes
no
or no? Yes or
study
no?
about that.
Yes.
There's no study about
No.
that. So
Like sweat from a
the
cook?
answer
No,
out of
no.
mine is no.
Please, what's the best medication to get rid of this Salmonella typhi? If you follow us very well, my brother, you will notice that we don't do this here. We don't come online and start prescribing medications to treat typhoid fever on social media. Hmm? So I'm sorry. There's nothing like we don't give that here. Hmm? The same thing again. This person is asking us, which medicine can I use to cure? Sorry, we don't do that here, Annie. Okay. Adiola says, sorry, doctor. So many times I have treated typhoid fever with medications probably prescribed by pharmacists. It will go, but after a while, it will come back. And my mom keeps insisting on using herbs that it cures it. I have not tried that though, but for a while now, I have not been having symptoms again though. Let me react quickly, then Dr. Israel will react. Number one, my dear, or madam, sorry. You said medications prescribed by pharmacy, so you are not seeing a medical doctor. Number two, we are not even sure if you are treating typhoid fever, madam. Hmm? Remember, we listed the diagnosis and how to arrive at the diagnosis from your symptoms and the type of test to be carried out. So, if you feel that you have typhoid fever, the best thing to do is to see a medical doctor. We do not, in most cases, tell you to go to the pharmacy, except in very few cases, we tell you can get this there. But for this kind of complaint, you should be seeing a medical doctor first before going to even carry out any tests, before taking any medication. So you have not been doing the right thing, madam. Dr. Israel, you want to add anything to this?
No, I think that as well. Just see a medical doctor. He will tell you the test to do, and with the test you will know if you actually have typhoid. It may not just be typhoid. It may just be something else. And with that, they will also know what to do for you. And I will also want to add that um, when you find out that you are coming down with okay, maybe because you are presenting with the same symptoms, you find out that you are coming down with the same symptoms often and often and often, please try and check your hygiene level as well. Try and check your hygiene level. It can just be the problem. So if your hygiene level is not top notch, please increase it. But as we earlier said, visit your doctor because nobody has said you have typhoid. Even you don't even know if you have typhoid because you have not gone to the hospital. You only went to the pharmacist. So visit your doctor to be sure of what you have.
Yes, very important. Visit your doctor. Okay, if you have any questions, please don't ask us for prescription. Don't ask us for medicine. Yeah, I beg you. Hmm? Yeah. We'll only advise you. We cannot prescribe for you on this platform. So So there are other sicknesses that might look like your typhoid. The very common one would be malaria. You can have malaria, it looks as if you have typhoid. Sometimes you can also have a urinary tract infection. Might look as if you have typhoid. So very important. We encourage you not to make self-diagnosis. This is why we are here. This is why we advise you. You might have malaria and you carry out your whiteout test. The whole 1 over 160, 1 over 180, whatever, will look so reactive, yet it is not typhoid, it is malaria. Now, even if you have had typhoid before and you test yourself with the whiteout, it might still be reactive. If you had typhoid before and you go carry out the whiteout test, you can still see it as if you have typhoid. And the people at the lab are not helping us. They make it look as if we are not doing anything right. So we are appealing to you when you go to the hospital and they tell you to carry out the whiteout test, tell them that, but I heard that this whiteout test is no longer advised. It's now discarded. What is the other test? Is it stool, MCS, or blood culture? Yes. Dr. Israel, do you have anything to add to that?
Well, nothing. I don't think I want to say anything again on that.
Yes. Okay. If you are listening to us and you have questions on typhoid, please ask now. Ask your questions on typhoid. Not tomorrow. You'll be trying to like private chat. Please use this opportunity to ask us your questions on typhoid fever. We have a question. Do you have any comment here? I have learned a lot this evening. Your platform is always educational. Thank you. God bless you. Thanks, Dr. Israel and Dr. Fred. I think I have learned a lot. Thank you. We appreciate you for always coming here tonight. We are now privileged to have this program run on Facebook and this program running on YouTube live so that we can reach a wider audience. But what will appeal to you to please help us share this video, invite your friends. This is the least you could do for them. Healthcare is expensive, guys. Healthcare, see, hospital bill is expensive. So we are here giving free advice, educational health content that will help you. So help us invite your friends, share the videos to them, the flyer, share to them. Abby, we know they try. Yeah. Oh yeah. Any more questions on typhoid? Any more? Um. Okay, this lady. Yes. I see this. Thank you, Ada. Doctor, can typhoid fever cease or delay period? Typhoid fever. So let me help you, make you understand something. First of all, we have to be sure that you have typhoid or different. Number two, if you have typhoid, the severe form, like the second phase or the third phase, the severe form of the infection can overwhelm your body, can make your body fall so sick that it can affect your period. But in the beginning, in the normal progression of typhoid, it will not affect your period. Do you understand? It will not. There are other things that will delay your period. Those ones are very common. For typhoid to delay your period, it means that that typhoid has broken you down and you will definitely be in the hospital. It's not the one you will sit down at home and say, I cannot see my period, a typhoid I get. Very wrong, madam. So typhoid is not among the first 20 causes or even 30 causes of delayed period. There are other things that can delay your period. But if you're having the complicated form of typhoid, that it breaks down your body, you're beginning to have systemic organ dysfunction. That one feed there. Good evening, sir. Please, are you saying whiteout test is not effective again? That is what we have been saying since morning. Agatha, are you just coming? That is what we have been saying since morning. We don't use it anymore. Full stop. We know they use them again. It's the sensitivity and the specificity is very low. You can have malaria and whiteout test will show looking as if you have typhoid. You can have typhoid last 2 months and you will carry out a whiteout test and it will be reactive and you will think that you have typhoid. My dear, it is not typhoid you have. You understand? So we don't work with that whiteout anymore. Can typhoid cause waist pain? No. If you have waist pain, you should be speaking with your doctor. There are other things that will cause you waist pain. I know what people are trying to do. You are trying to tie your symptoms to typhoid. Madam, exactly what I'm feeling now. You should be seeing a doctor, Ada, please. What we said in the very beginning, before we started talking about the symptoms, is that if you have any of the symptoms mentioned here, we are not telling you to make the diagnosis of typhoid. Please. What we are saying is that there are so many medical conditions, even malaria, urinary tract infection, can give you such presentation. So don't say because we mentioned headache, abdominal pain, um, fever, malaria, body pain, then you now have typhoid. No, we listed the symptoms and we also told you about the diagnosis. Again, we also mentioned that do not carry yourself to the laboratory. Do not take yourself to the pharmacy. Speak with a medical doctor. Medical doctor. So Israel, please, do you have anything to add to this?
This one thing I find it so difficult to address all the time, because the more you tell them, the more, I don't know if they get confused or they just don't want to know what we are trying to say. I'm trying to differentiate those two things, because you will keep on saying, please do it this way. I know the economy is not actually helping matters. I think that's one of the reasons why we're having such issues, because they find it very they find it so expensive going to the hospital to book, say, a doctor and all that. And they also think it's time wasting to do those things. However, it is the right thing to do. It is the right thing to do. You need to go to the hospital, you need to see your doctor and make your prescription. And most of us have also made the doctors to also prescribe wider, because they've spoken to us and we don't want to listen, and now they just want to get their money from you. They just want to get money from you, and they just, yeah, go and do wider now. Anything it gives to me, it is. Even when they know that that's not the right thing. If any of you can actually, when you see your doctor and he say, you go and do wider, and you tell the doctor, see, look at what I've heard, you hear that the doctor will start telling you the right. He will just tell you the right thing, because he knows that yes, you are enlightened. So please, we are trying to enlighten you guys. We are not here to tell you your symptoms or to tell you that your symptom is related to this and that. We are not here to do that. We are just enlightening you so that when you get to the hospital, you're already enlightened. You already know what is going on. You already know how to present your case, and so that you get the best diagnosis and the best treatment. That's what we are doing. And another thing we are also doing is just to try to help you prevent some of these diseases that can be prevented, instead of coming down with it and use a lot of money to treat yourself. You can just prevent them, and you can just prevent them. So please, let's not be looking for ways to tie our symptoms to any topic that is brought out. Let's just try to do the right thing by first go to the hospital, see your doctor, do the test, and get treatment. Thank you.
Thank you, Dr. Israel. We are about rounding up. The next maybe 5, 7 minutes, we are done. I had a story some time ago. A patient came to see me, and then I told the person said, um, I have malaria and typhoid. So I said, malaria, yes. Typhoid, I don't think so. So the person now said, are you a doctor, number one? That's what the person asked me, life matter, and said, is there another doctor in the hospital? Let me see another doctor because I don't think you know what you are doing. Because I said, I don't think you have typhoid. Our people have been conditioned to believe that it must be malaria and typhoid. And if you refuse to follow them, they prefer to go to the pharmacists to get medications, not listening to the doctor. Like Dr. Isa has said, please, I beg you. Things are hard, times are hard, we know. But to avoid spending more, let's do the right thing. Please, doctor, I have been suffering from this typhoid fever so long, but I have used medication, but not going yet, causing weakness to my body. What can I do now? Dr. Israel, advise quickly. Let's go to the next one.
Okay. What I would say is go to the hospital, because I don't think you've gone to the hospital, and I don't think you've done the right test to know if you really have typhoid. Maybe you just did a wider, and you should know that wider is not a diagnose. It's not a test used to diagnose typhoid, because malaria can still show. Let me use the word positive in typhoid. In wider. Urinary tract infection can also show it. Stress can show it. After you have treated yourself using medications, can also show positive in wider tests. That's why it is not the right test to do when it comes to typhoid. So, madam or sir, if you think you are having, if you think, please go to the hospital. Let them do the right investigation and know the right drug to use for you. Don't. I also believe that you've been going to the pharmacy, and also after you have gone to the hospital and they have done the right test, and maybe peradventure it comes out typhoid fever, the next thing you should do is to increase your cleanliness. Eh? You should also increase that so that you will prevent further infection from maybe things that are already being infected with the salmonella itself. Thank you.
Sir, please, what if the doctor still does the wide down and that's the only medical personnel in that area? What do we do, sir?
Now, we said something that cannot be the only test in that area. It's just because most of us have conditions, most of our doctors, to the extent that now the doctors just want to collect their money. Yes, that's why most of them do that. There are so many clinics, so many hospitals that actually does not have a standby lab, and that is they don't have lab inside the hospital, inside the clinic. So they send you to go and do the test outside. So it simply means that it cannot just be the only test in that area, because most hospitals send you to go and do other tests in different places, in other laboratory facility. Why can't they send you for that? So just be rest assured that it's not the only one. So they can always send you to go and do it somewhere else. If you are so very weak, that you cannot move, they can start treatment empirically, giving you some medication that can make you strong, and send the sample, not you going to wherever the lab is, but send the sample to that place. And the test will be conducted, and then we will know if actually this person have typhoid or not. Because as I earlier said, not all hospitals have a lab inside the hospital. Mostly private hospital, most of them don't have a lab. So they partner with some labs. So when they even call you when they tell you that I will collect your sample for test, they collect your sample and send it to that lab. They don't do it there. So you should know that. So don't think that yes is the only test. It is not. It is not.
Thank you. Let me react to this comment quickly. As far as you are in Nigeria or Cameroon, typhoid will always reoccur because of the water we drink. So, this is how it is. Yes, because we are in developing nation, our sanitation is poor. Because we are in developing nation, sanitation is poor, hygiene is poor. But that does not mean you can't prevent typhoid. There are people that have not had typhoid fever all their life. I can't remember the last time I had typhoid fever. I'm talking even before I became a doctor. I have had patients who have never had typhoid fever. Why? Your hygiene. So if your hygiene is poor, if the food you eat is contaminated, you buy fruits, you don't wash the fruits, there's a very high tendency that you will have typhoid. It's preventable. as Dr. Israel has said. But some people we have typhoid even because of the people that prepares the food for them. So you can be in a developing nation and still not develop typhoid fever. Is that okay? Like Dr. Israel has said, all we are talking about is prevention is better and cheaper. Let's prevent typhoid. How? Wash your hands after going to the toilet. Wash your hands before eating. Ensure you cook your food. Ensure you don't eat cold food. When you are buying your foods outside, ensure that the person preparing the food for you observes good personal hygiene, not just buying food anywhere. And then, if you can get the vaccine, but the vaccine does not give you lifelong protection. Dr. Israel, any final words to add as we round up tonight?
Yeah, yeah. For this, and as far as you're in Nigeria or Cameroon, that's why we talked about the vaccine. We said something that if you're in the area where typhoid is always is common, the vaccine will actually help you. And yeah, as I earlier said, it's not like it's 100%, but it can help you to a great extent. When you take the vaccine and you keep up with other preventive measures, you rest assured that you are protecting yourself. And apart from that, as Dr. Fred said, which I think I've said as well, the vaccine is not a lifelong, it does not give you a lifelong protection. So after some years, I think it's 3 to 5 years, it wear out and you need to take another shot of the vaccine. Now, the last thing I want to say before we call it a day is that one, prevention is better than cure. So let's try and prevent ourselves, wash our hands as often as possible, wash our fruits before eating. Please make sure you warm your food very well before you eat as well. And also note that typhoid, malaria and typhoid, as Dr. Fred said, are not brothers and sisters. You must not, it's not you don't always have two of them together. Because if you have two of them together, actually, okay, you don't actually have two of them together. And three, wider test is not is not a test to diagnose typhoid. Again, wider test is not a test to diagnose typhoid. Thank you.
Thank you, Dr. Israel. Thank you so much. As I also round up tonight, I don't know, I don't want to add anything again. All I want to say is please do well to speak with your doctor. Try not to do self-medication or make self-diagnosis. For those that feel they have typhoid or you have been treating typhoid before, I appeal to you, please speak with your doctor. And once again, we want to thank every one of you for joining this program. We appeal again, share this video for us. That is how you support this page. You can send stars, oh yes, you can send stars on Facebook. On YouTube, you can send superstars, super chats, super stickers on YouTube. You can do that. That way, you're supporting us. And I pray and I hope that by the grace of God, we'll always be here every Sunday by 8 p.m. to respond to your comments and provide you up to date medical education. I think, yes, compliment of the season, everybody. So we are in the Ember period, Abby. This is the second episode this month. So we are wishing you all Merry Christmas as we go towards the end of the year. Wishing you all a prosperous new year. And as you plan for yourself this December, please be safe. Take your health seriously. Don't be careless. Do not keep petrols, fuel, flammables around your environment. Ensure that your kids they know what to do in case of emergencies, and when you're trying to travel, make necessary plans ahead of you. And like I always say, good life now waiting. Good life now
Na
waiting.
sense.
Good life now sense.
Na sense.
Thank you. Thank you. No questions from my end. Just listening and taking all the information and knowledge. Yeah, this person asked me a question. This person, sorry, I missed this. Please, doctor, do you have a video on genotype and blood group? Chituga Sonny, I don't have a detailed video on that. I don't have a detailed video, but I have made a video. It's not on Facebook, it's on YouTube. But I will try, by the grace of God, to make a video on genotype and blood group very soon. Thank you, Dr. Israel. Thank you, Dr. Fredo Star. Good in life nonsense. See you all next week, Sunday. Same time, same place. Take care and bye bye.
See you.
Yeah, so I'll be shutting down in the next 15 seconds. I'll be shutting down this live stream in the next 15 seconds. So thank you, thank you. Please share this video. Please, thank you. Help us share. I beg. Tag your friends. Huh? Yeah. 3, 2, 1.